I am now setting the goal of 100,000 tests per day by the end of this month.
An ambitious target, but with less than a week to go, the UK has only managed to reach about 30,000 tests a day. Now the army is being brought in to reach this goal by operating 96 mobile units to test key workers showing symptoms of coronavirus. But why is mass testing only happening now? The UK began testing in February. Drive-through sites for people who had been referred by NHS 111 were launched. However, in March, when Prime Minister Boris Johnson declared the virus could no longer be contained, the government changed its approach. Now tests were only to be offered to patients in hospital. But fast forward another month and the government has switched back to its original approach and now is aiming to test 100,000 people a day. How did the UK fall behind in testing? Shortages in UK equipment like swabs and chemical reagents held back the UK's testing capabilities. Then there were the facilities. Initially, Public Health England only started with its own 8 labs. Then it expanded to include 40 NHS labs and then to laboratories from universities and private companies. Why is testing important? Countries like Germany, who conduct around 350,000 tests a week, have had fewer coronavirus-related deaths than many other European countries. Their widespread testing enabled them to identify positive cases early on and prevent the spread of the virus by being able to alert those who needed to self-isolate. What are the tests? There are 2 types of COVID-19 tests, the Have I Got It test, otherwise known as the PCR test, and the Have I Had It test, otherwise known as the antibody test. The test that is being carried out across the UK is the PCR test, which uses a swab to take samples from the patient's nose or throat to detect if someone is infected. The other test, which is not being rolled out, is the antibody test, which looks for the presence of antibodies in a person's blood to determine whether they have recently had the disease. The UK has not approved these tests for mass use because the ones they've evaluated haven't been accurate enough. Who can get the test? Essential key workers and their families in England who are showing symptoms of COVID-19 can apply for an appointment. But even getting a slot can be tough. Following significant demand, the government website had to temporarily close until more appointments were made available. What happens once the testing goal is met? There isn't any evidence to say whether a person who has had the virus is immune to COVID-19 and protected against reinfection. So when lockdown is lifted, key workers may have to face testing several times.